They're also cautioning the use of acetaminophen among young children as well in this. I want to bring in ABC News medical correspondent Dr. Darien Sutton, and I want to touch on something, Dr. Sutton, that Selena brought up here, because we know the president, again, as she pointed out, essentially giving medical advice to Americans, said that you should limit the use of acetaminophen if you're pregnant, if you're a woman, if you just can't tough it out. First and foremost, I think the concern here that they were looking into, though, right, is not the mother. The concern is of the fetus and what happens when you take something like acetaminophen.
And that concern was prompted likely from a recent study that was in collaboration between Harvard and Mount Sinai, citing an association between the use of acetaminophen or Tylenol during pregnancy and the outcome of neurodevelopmental complications. Now, important to note again, and I think that this is important to underscore, that this study was investigated in 2024, more than 2 million children, and when looking at sibling comparisons, this association was not found. And just to go back, because the president had shared a lot of direct medical information that was frankly incorrect, dangerous, and harmful, it's really important to understand that when you have a fever in pregnancy, that in and of itself significantly increases the risk of harm to mother and child, which is why the American College of Obstetrics and Gynecology recommends that pregnant mothers talk to their providers and also note that it is okay to take acetaminophen during pregnancy, especially in the setting of a fever. When we're giving information and giving recommendations as clinical providers, we are doing so to make sure that we can reduce the risk as much as possible, but there's no way to eliminate that risk. And when you're looking at the risk and benefit of something like a fever, an untreated fever that can go on to lead to complications in pregnancy, preterm birth, and a stillborn if your fever is high enough, and not treating that with acetaminophen, that can lead to harm. So it's so important to understand that when making decisions, as difficult as it already is today for pregnant mothers with the amount of information and misinformation that circulates around them, this is really important to understand that if you were to have a fever during pregnancy, if you were to have pain during pregnancy, it's important to understand the data has not changed. Acetaminophen, the active ingredient in Tylenol, still remains one of the most safest options to take in pregnancy.
So to follow up on a couple of things there, though, in terms of inaccuracies, we heard some from the president, especially regarding vaccines. But in terms of the growing number of autism cases that we're seeing in this country, the president did cite 1 in 31 across this country. That's a sharp increase, and 1 in 12, which is for boys in California. And on that note, Dr. Sutton, we heard from RFK Jr. as well, says essentially they'll be asking physicians to have these conversations with their patients where they would caution the use about acetaminophen. They would advise a low dose and a short duration use. So what's your take on that?
Well, that's actually the standing recommendations. If you look at the leading institutions, for example, the American College of Obstetrics and Gynecology, they recommend that when using Tylenol, you want to use the lowest effective dose for the shortest period of time. That is to make sure that you're getting the most benefit while reducing the risks. In terms of why the rate of autism has increased, now we've understood through multiple different studies, through data and analysis, that it's not necessarily that more babies are being born with autism, but more likely the increased awareness of autism, the decreased stigma, the increased likelihood of parents to get screening, and also the broadening definition of what autism is and what the reasons why we have the diagnosis of autism spectrum disorder. It's all of these reasons compounded with likely genetic factors, which studies have shown that up to 80% of autism cases are associated with genetic mutations, as well as possibly environmental causes that lead to the outcomes that we see today. Important to understand it is so much more complex than a simple binary yes or no or a simple finite reason.
So, Dr. Sutton, can you play it out for us when the administration starts to encourage doctors to change how they think about it, if they are, but there's also going to be a safety label change as well here? How quickly does any of that happen, and how does that work? And if you're currently pregnant and worried about this, what do you need to be doing?
Well, the safety label changing that's work within the FDA, that would likely take a significant process, possibly months, even longer, in order to create a claim that would provide some increased level of risk. Important to note, the FDA has already reviewed the evidence associated with the acetaminophen or Tylenol use in pregnancy and has stated that they have not found clear evidence that the appropriate use of Tylenol in pregnancy leads to adverse harm. This question was already investigated, and the statements today are not based on anything that is new. So I think in terms of understanding what to do as a pregnant mother and expectant mother, leaning on the institutions that have guided pregnancy and have improved outcomes, such as the American College of Obstetrics, such as the American Academy of Pediatrics, leaning on that institutional knowledge so that you can separate fact from fear.
Separate fact from fear, especially if you're navigating this as an expectant mother yourself. Again, the president saying that the FDA will begin notifying physicians that the use of acetaminophen, in their opinion, can be associated with an increased risk of autism. But as Dr. Sutton there pointed out, it's important for every person to have those conversations with their own doctor. We're going to